Hello families, if you're watching this you're probably doing the online filial therapy training with me, and this is just a video just to talk to you a little bit about what filial therapy is, but obviously we'll be covering that in your training much more thoroughly as well. There's some videos on my YouTube channel for you to watch to see filial therapy in action. Please dads, don't let it put you off. It's mums that I've managed to get to record the sessions with their children. It's just really difficult to get dads to do that for me, but there's loads and loads of dads that have participated in filial therapy and very, very successfully, so don't let that put you off. So filial therapy, what is it? People are very interested when they hear the word filial and wonder what it's all about, and filial basically just means family, and it's a family type therapy that's based on play therapy and the play therapy skills that we use as play therapists to work with children in a therapeutic way and help them to process any worries or any experiences that have been difficult for them. And filial therapy works really well because it allows families, parents, to work with their children in a similar way, and really opens up communication between children and parents, and gives you a much deeper understanding of your child and what's going on for them, because children communicate naturally through play. And as a filial therapist, I've got a massive belief that parents are the most important people in their child's life. So for me to engage with parents in filial therapy is really quite magical and an enjoyable experience, and I absolutely love doing it. So I'm really pleased that you're going to be still doing the filial therapy, even though it is online at the moment because of the corona situation. So let's keep going with it. Let's learn these skills and do what we can for the children. So filial therapy was developed by Louise and Bernie Gurney in America, and they developed a program because they felt that there was a massive gap in terms of therapeutic work, and that therapeutic work didn't always address sort of the relationship between children and their parents, and you know, it's one thing to take a child off and do therapy in a separate room, but if the parents are unaware of what that's about, or you know, how they can continue to help their child after that therapy comes to an end, then things might go backwards, or you know, it leaves a certain gap for children and families in terms of moving forward and continuing the progress their child might have had. Filial therapy fills that gap and is a really powerful therapy as a result of that. But yet it's all done through playfulness and fun and joy and connecting with each other as a family, and that for me is really, really quite vital and magical. It's also based on how polar bears play with their cubs. So a mum polar bear will naturally play with one cub at a time and give each cub individual time, and filial therapy is very much about that, giving each child in the family individual time, and time that the child actually leads. And I think that's the important bit, that yes, there are rules to keep the child safe, but generally the child has the permissiveness in that interaction, in that relationship, to develop that play in any way that they want to. And that's the bit that's really important in filial therapy and play therapy, that children get to lead that therapy and get to lead those sessions, which is really empowering for them. And what you find with both interventions is children's self-esteem and self-worth really flourish when they've got an intervention where they get to lead and be in charge a little bit, because children don't get to be in charge very often. And you know, this is a special playtime where they're allowed to be in charge. It doesn't mean they're in charge the rest of the time, and that's part of the training that we'll work on, and why that's important, that at those times they get to be in charge and lead the play. Okay, so the sort of skills that you'll learn in filial therapy are to structure. So you will structure the sessions, which involves you setting up the play sessions, children not involved in that, and you also tidy it up, which is different to everyday life. And I'm not saying that children shouldn't tidy up at other times, but for play therapy and filial therapy, you know, the adult is in charge of that bit, because then the child comes in and it's on your terms when you bring the child into the session. So the time will be set and you try and keep the same time each week and the same day. So if you decide that Monday tea time is going to be your special playtime with your child, that's what you would really try to stick to. So pick a time and day that's going to work for you and your family ongoing, that you can keep going for as long as possible. So part of the structuring is the time, the day, the place, where you're going to have that, the kit, the toys that you're going to use, which I'll help you with as well, and the fact that you set that up and get that ready for your child to come in, so that it feels special. It's all set up ready for them. They come in, their time is not used to set up or to tidy up afterwards. They want that time that they've got with you to be really thorough and special, and that ranges between 20 to 30 minutes. Some families might extend to 40 eventually, but you start with 20 minutes when we first start filial therapy. So that's, you know, a short period of time, so it needs to be really structured for that child in terms of, you know, that they get that time to play and not to have to tidy up or set up. Also part of the structuring is the initial statement that you'll learn to say. So when you start a filial session, you'll be saying to your child, let's say your child's Johnny, you know, Johnny, this is your special playtime, and you can do pretty much anything you want to do in your special playtime. You can play in ways you want to. If there's anything you can't do, I will let you know, and I'll let you know when you've got 5 minutes left. And you might have a time statement in there as well of, you know, you've got 20 minutes to play, and I'll let you know when you've got 5 minutes left. Okay, so it's similar to that sort of statement. It's not always exact, but, you know, and you'll say it in a way that feels comfortable for you, but it's an introduction statement that basically lets the child know that this is a special time for them, and that they can do pretty much what they want to do as long as it's safe. But that you're also saying, but there are parameters around that. Now, it's really important that you don't start listing what you think the rules are going to be, or what rules you think your child is going to break, because the problem is with that, you start to put pressure on a child and they'll not relax and enjoy the time if they feel like they've got to follow lots and lots of different rules. Also, you want to sort of believe in the child. When you do play in filial therapy, you believe in the child that they can make the right choices. So you don't give them rules until you really need to. Okay? And that, so that also part of the structuring is then that you give them the 5-minute warning as you're coming to an end. And then for some children, you might give them a 1-minute warning if they really need that, because they find it hard to end sessions, which quite often children do. And then you let them know when it's time to end, and you follow through with that ending, but also using your reflections, which is one of the other skills that you'll learn. So the most important skill really is reflections, and reflecting the child's feelings throughout the session as much as you possibly can. And reflecting feelings is just basically stating what you see, being attuned to your child, looking at their face, looking at what they're doing, seeing when something's difficult, seeing when they're enjoying something. These are things you'll notice all the time as a parent. You just might not always say it. So in a filial therapy session, you'll be reflecting your child's feelings throughout. So, you know, you might say, "Oh, Johnny, you find that really difficult. I can tell because your face looks so fed up with that." Okay, so you're connecting up that feeling with what that child might be presenting to you, and this is really important in terms of them knowing that you're really noticing them and understanding them. And that's the real powerful therapeutic bit, is that they feel heard and understood, and they also start to develop more understanding around their own feelings. Sorry, this is not corona, this is my heater too warm in the room, so I'm just going to turn it down. Okay, so that's the important bit, is the reflection of feelings, which we will be practicing quite a lot of in the role plays that we do, and you'll see those reflections used on the videos that are examples for you as well. The other part of the special playtime is that you are tracking the child's play, and that just means that you're saying what you see the child is doing, so they know that you're with them throughout the session, and they know that you are there and available to play if they need you to. Okay, so that might be saying, "Oh, you know, oh, you've gone for the baby doll now, or you've really given the baby doll a cuddle, or you really know how to look after that baby. And that's the sort of tracking that we do in play therapy and filial therapy, and again we'll be practicing that, and that is just about you being available to the child. Quite often parents will say, does that not get annoying? Does it not get irritating? Sometimes children will say to you, you know, don't talk as much, or they'll indicate what they need from you, but most of the children I find that really reassuring, that you're with them all the time. They know you're still available, you've not disappeared off on your mobile phone or thinking about other things. You're still with them, and you're continuously with them throughout the session. The other part of filial therapy, which is useful as well for parents, is the limit setting that's used, and it's a 3-step procedure. So limit setting in filial therapy and play therapy follows a process. The first bit is that you set your expectation for the child, and this is where you state that there is a rule. Okay, so let's say the child, Johnny, has hit you with the sword, and one of the rules, of course, is that children are not allowed to hurt you, they're not allowed to hurt themselves, they're not allowed to damage equipment, and they're not allowed to damage anything in your room, you know, wherever it is you're doing the therapy session. So I'd state to Johnny, you know, Johnny, one of the rules is, you know, you really enjoying using that sword, so you would say what they like or what their feeling was, or you were really angry then, because let's say Johnny's got angry with me for some reason, but one of the rules of special playtime is I'm not for hurting. Okay, it's that simple. So you set your expectation. If then Johnny breaks that rule again, you would then set that there would be a consequence to that, and the consequence in a filial therapy session is that this session would end. Okay, so you would say to Johnny, you've chosen to hurt me again with the sword, even though I've told you that's not okay in special playtime. If you choose to do that again, we'll have to end special playtime for today. That's the warning. That gives Johnny a chance to pull it round and change and not do that again. Of course, if Johnny does that again, you follow through, and that can be really difficult to do, but you must do it, because that gives the child the message that you are going to follow through on what you say. You know, it helps children to feel safe and secure, and then they're less likely then to break those rules the following time, and in everyday life as well eventually. So then you would say, Johnny, you've chosen to hurt me again with a sword, even though I've told you that's not okay in special playtime, so we are ending special playtime for today. And you know, you're a little bit firmer, but your voice stays calm throughout. And then you would, if Johnny was resisting, you would reflect, this is really hard, really difficult for you to end, but we are ending for today. And you would stand up and you would take Johnny's hand and lead him out of the room. Okay, so it's quite structured and firm. So, and the other part of filial therapy, of course, is learning to play imaginatively and going along with role play that children might put you in. So if a child says to you, you know, you're going to be the doctor, I'm a patient, I need you to make me better, you go along with that role. So, oh yeah, okay, I'm doctor today, what seems to be the problem? And you go into that sort of role play so that you're enabling that play for the child and allowing them to interact with you in a way that you very rarely would do at other times, I would think anyway. So they're the main filial therapy skills that you will learn and that we'll be practicing ready for your sessions with your child. Once you've got those skills at a level where you feel that you're okay and you know what you're doing, then we start the sessions, which I'll observe online and then give you feedback. Okay, and don't worry, the feedback's supportive. It's about, you know, not expecting you to be, you know, qualified therapists or anything like that. It's a way of helping you to develop those skills further. All right, and I still get it wrong as a experienced therapist, so you know, none of us are perfect. So I'm really looking forward to teaching you the skills, and we'll be getting on with that soon, hopefully. Okay, thank you, bye bye, and take care.